need to take very bold action, aggressive action to address these new threats. It's Omicron, it's cold weather, which we know presents a real challenge with COVID in every form. It's the holiday gatherings coming up. There's a lot going on, and what we're seeing now in other parts of the world, and this is really an area of tremendous concern, we're seeing restrictions starting to come back. We're seeing shutdowns. Look at Germany right now. Such a strong nation in so many ways, but the situation there has gotten to a really troubling place. So now they're reinstating a lot of restrictions that we all hoped were part of the past. We cannot let those restrictions come back. We cannot have shutdowns here in New York City. We got to keep moving forward. Another really big, important step, and this is going to be a first in the nation step. You're going to hear from our health commissioner in a moment, and he will be issuing a commissioner's order for all private sector employers in New York City. It is time. Look, this is how we put health and safety first, by ensuring that there is a vaccine mandate that reaches everyone universally in the private sector. A lot of folks in the private sector have said to me they believe in vaccination, but they're not quite sure how they can do it themselves. Well, we're going to do it. We're going to do this so that every employer is on a level playing field. One universal standard starting December 27th. We're going to be working with businesses all over the city. And that's almost 200,000 businesses that are not already covered by the Key to NYC guidelines right now. Another point on Key to NYC, thinking of the youngest New Yorkers, the vaccination for the 5 to 11-year-olds. It's just begun in the last few weeks. Already we've gotten over 127,000 New York City kids in that age range vaccinated. That's great. It's a little over 19% of all the kids in that group. Considering it's brand new, that's good, and it's better than the national rate, but it's not enough, obviously. We need to see a lot more. We need to see kids getting vaccinated in that age group. Parents, we need you to step up for the good of your children, your family, all of us. Go get your child vaccinated. So we're going to include them in the Key to NYC, the guidelines for Key to NYC, starting on December 14th. So this is, again, one dose now because it's a new vaccination. This is something that's going to keep kids safe and families safe. Go get your child vaccinated. As long as they've gotten that first dose by December 14th, they can continue to participate, indoor dining, entertainment, all of these great things.
Hi. And we just heard Dr. Russell speak to the fact that those who are unvaccinated are at most risk of being hospitalized with COVID. Also, under Level 1, masks are required in outdoor public spaces when physical distancing cannot be maintained. Physical distancing is required in public spaces where proof of vaccination is not required. That means that malls, grocery stores, retail stores, and salons and spas must enforce physical distancing between patrons. Alternatively, they also have the option of requiring proof of full vaccination from all patrons, but we will leave that decision up to individual businesses. These are the main differences at Level 1, but the Winter Action Plan has 2 more levels that include further measures, including reduced household bubbles, lower capacities in public spaces such as retail and restaurants, and no travel into or out of areas at Level 2 or Level 3.
In a Bavarian hospital struggling under the weight of coronavirus patients, intensive care workers turn on red lights at night, a message they want Germans to take heed of. The government in Berlin is delivering messages too, upping the pressure on Germans who have yet to take up the vaccine against the virus. A number of German states already bar the unvaccinated from public venues, including shops, cinemas, and restaurants, even public transport in some cases. German Chancellor Angela Merkel, in one of her last acts in the role, says those restrictions will now apply right across the country. Access to leisure, sports, and cultural activities, she says, will be limited to those who are vaccinated or have recovered. The German parliament will debate mandating vaccines, potentially following in the footsteps of Austria, which has pledged to start in February. And Greece will enforce them with fines for citizens over 60. The issue divides Germans.
Also sonst geht's nicht
We
voran.
need it, otherwise we won't get anywhere, says this woman.
Gegen eine Impfpflicht bin ich schon.
I think everyone should decide for himself, says another woman. Germany has one of the lower vaccine uptakes in Western Europe, and it's in the midst of a serious COVID upsurge. Deaths are now averaging about 300 a day, putting pressure on hospitals. In Brussels, the European Commission has also raised the issue of mandatory vaccinations.
This needs a common approach, but it is a discussion that I think has to be led.
It's not just numbers driving the decisions, of course, it's also fear over the potential impact of the Omicron variant. Margaret Evans, CBC News, London.
Ripasso il documento gentilmente. Sospendiamo un attimo. Grazie, buon proseguimento. Vuole controllare?
Ok, sì, ora ti controllo. Aspetti, Prego, si accomodi.
A bitter pill to swallow this morning for the unvaccinated. Queenslanders needing life-saving surgery. It's been revealed that patients will be denied that procedure unless they're fully vaccinated. Many say they're not anti-vax, they're just fearful of the side effects. That policy won't be re-evaluated until February next year.
Unvaccinated people can expect to pay more for their health insurance premiums before the end of 2021. That's according to Thomas Campanella of Baldwin Wallace University in Ohio. He says he believes companies who use self-funded health plans will raise their health insurance premiums for those who are not vaccinated against COVID-19. He says there is also speculation that larger insurance companies will start charging more as well. Starting in November, Delta Airlines announced it will charge unvaccinated employees an extra $200 a month for the company health plan, citing the high cost of COVID hospitalizations.
The increased cost from a hospital stay standpoint for unvaccinated people related to those services was in this past year $3.7 billion. So obviously there's a lot of costs related, especially if you're unvaccinated and they are more likely to get COVID and they get into the hospital setting, and between ICUs, ventilators, it gets quite expensive.
Campanella says he believes employers are not looking to penalize their employees for not being unvaccinated, but are looking for more ways to have a healthier workforce.